Awesome. I think everybody is in now, so we can go on ahead and get started. So, welcome everybody to our virtual sharing alumni advice Wednesdays or with SAA. Tonight is our healthcare event, and we have three amazing alumni to kick it off for us. First, we do want to kick off and acknowledge that we are coming from all parts of the world, from all different time zones. So we do want to thank you guys tonight for actually being here at this event. To get started though, we do want this event to be conversational with ourselves and the alumni. So if we could fast forward two slides into the PowerPoint, just so I can go over kind of how we're gonna make this a conversational piece. So this event is set up for all the students on this call right now and all the attendees to ask whatever questions you have related to healthcare careers or any specific questions that you want to ask our alumni on how their life was at UMass, how did their life at UMass shape how the career that they got, and things of that sort. In order to do so, there's a couple of ways on how you can kind of ask your questions. So we have myself and McKenna are going to be hosting this call today. McKenna will be running the questions. So if you can send all your questions related to McKenna in the chat, she can answer them directly to you or open them up for the entire all the alumni to answer, so somebody can get their question answered by either one of them or all of them in that sort of sense. And then looking at your screen, I do want to point out one other feature that we do have, and it's our raise hand feature. And this is what you're going to do before unmuting yourself to ask a question, which is allowed also if you want to actually have a conversation with the alumni, you can unmute yourself. So all you have to do is go to participants, click on the bottom right. It should have, or excuse me, the bottom left side of your screen should have a little raise hand button. And then once you click it, this raise hand icon will pop up on your screen, and then it'll prompt us to let you unmute yourself to ask the question as well. So now to get started, we do want to start with some introductions. So to begin, my name is Aaliyah Robinson. I am a senior here at UMass Amherst. I am the Alumni Relations Coordinator in SAA as well. And that's a little bit just about myself, and I will be hosting and moderating tonight's event and things of that sort. So I will now turn it over to McKenna, our other host, to introduce herself.
Hi everyone, my name is McKenna. I'm the Vice President of Training and Development for the Student Alumni Association. I'm a junior in nutrition and public health double major, and I'll be here to answer any questions, as Aaliyah said. So if you have any questions, please put them in the chat directed towards me, and I'll be sure to cue you in to ask them yourselves by unmuting yourself and asking the panelists, or I can ask for you if you would rather not unmute yourself. Completely up to you, just message me in the chat. Thank you so much for coming.
Awesome. And now we're going to prompt our awesome alumni to go ahead and introduce themselves. So Joanna, you can go ahead and start with introductions.
Hi, good evening. Well, evening where I'm at. I don't know where other people are at. My name is Joanna Imbird. I was a psychology major, biology minor at UMass Amherst, class of 2015. And now I'm a clinical social worker at Brigham and Women's Hospital.
Thank you. Michelle?
Hi, everyone. My name is Michelle Pomerantz. I was a public health major at UMass. I graduated in 2014. I currently work at Boston Children's Hospital as a hospital research administrator.
Hi, everyone. I'm Katarina Anderson. I was a bio major and a Scandinavian Studies minor and graduated in 2011. I did med school at UMass Med School in Worcester, and currently I am a radiology resident, both diagnostic and interventional radiology at BIDMC in Boston. So we're actually all kind of within a block of each other, which is really funny, all three of us.
Yeah, that's really funny. I used to work at BIDMC at some point in my career, so that's really funny too.
So props to UMass for getting us all to very nice hospitals. And also, just as an added thing, I am the member at large for the not for the Student Alumni Association, but for the Alumni Association. So may have a chance to interact with you all in that form as well.
Awesome. Thank you, guys. So to get started with our questions, we do want to start off, I think, with most prevalent question of today's time, and that is about COVID-19 related. So how has COVID-19 affect your job experience personally? And I will send this right over to Michelle to start us off.
Hi, everyone. All right. So maybe I shouldn't have been the best to start because so COVID-19, I'm a hospital administrator. So for the most part, I work at home every day, even though I'm still working at Boston Children's. I'm home. I've been home since March. I go in typically once a month just to confirm like some office or some like hospital administrator tasks. But for the most part, I am home. I feel lucky. I've been able to do all of my projects and my research projects from home from my computer. And that's, one thing I think that's been really great is that the hospital has really set that up to help, reduce COVID risk for people who don't need to be in the, hospital. One thing is like my work did change a bit. I started working on like some different projects related to COVID, but for the most part, like most of you who are at UMass right now, I'm home. We're doing our part to stop the spread and working to just make sure that everyone has what they need make sure all doctors and nurses and other frontline providers have what they need to combat COVID.
Thank you. Katerina or Joanna, anything to add?
Sure. So I guess for me, I'm still in residency. So my residency training was definitely affected in a negative way, but also in, I guess, some positive ways. Our volume at the hospital, at the adult hospital, went way down. It was full of COVID patients, but in terms of the typical patient demographic that would come in and all the outpatient studies we would do, that all kind of was eliminated. So we had a short period of time or a couple months actually, where we really didn't have much work to do. So as a result, I redeployed myself to be more useful and actually ended up working with some COVID patients on a COVID ward for a couple weeks, which was a very interesting experience. Heartbreaking, but interesting. And I don't know, aside from just being confronted with having to go to work and facing your fears, I think it gives you a lot of growth experience to do things like that. I feel a little mentally stronger than I did before and not as easily fazed by a lot of things. So it does change you in positive ways as well.
I think for me, the biggest change is how I conduct my work. As a therapist, my work was always doing one-on-one sessions with patients and seeing people face to face. But since March, I believe March 16th, actually, we started doing telehealth. And telehealth is at first it was a lot of phone intervention. So calling patients and doing our 45-minute sessions over the phone. And then as time has gone on, the hospital got access to Zoom. So I see a lot of my patients via video now. And also there's a healthcare focused app called Doximity. And actually that app lets us video call our patients or phone call them using our office line as the caller ID number. So patients don't have your personal number. And that was also a change because at first we were using a lot of Google Voice and things like that. But with Doximity, we're calling our patients using our office line as a caller ID. I do go in once a week, and that's because I'm also helping so I'm at a community health center in Jamaica Plain, which is part of Brigham and Women's Hospital Primary Care. And at that center, there's a testing site. So actually on Thursdays in the afternoon, I help out with our testing site. So that was also a change to my workflow where aside of seeing my regular therapy patients, I'm also helping with the testing site for COVID-19.
Thank you. And to kind of go along with that question, what I guess was or is the hardest obstacle that you faced in achieving your current job position Yes, sorry. So yeah, what was the hardest obstacle you believe you've faced in achieving your current job position or any type of position that you're in now? And we can pop it right back to Joanna.
I think I don't know if it was a challenge, but you definitely have to put yourself out there a lot. There's a lot of jobs in the healthcare field, especially in this state with so many hospitals and different opportunities. So I think you have to be very proactive. And by that, I mean, you really have to look at your resume, your cover letters that you're sending different positions and really personalizing them for the positions that you're applying to. Once I graduated at UMass Amherst, I worked for 2 years as a clinical research assistant at BIDMC in Boston in the psychiatry department. And in order to get that position, I really worked with career services at UMass and with some of the advisors in the psychology major to really help me tailor my resume and my cover letter for the position I wanted, which was doing behavioral health research with human subjects. So I did that job for 2 years. And then from there is where I kind of found my passion for social work and went back to graduate school and did my 2 years master's. But from the starting point, I definitely think was utilizing my resources at UMass to make sure that my resume and my cover letter were representative of who I was as a candidate and what the position I really wanted.
Thank you. Katarina, anything on that as well?
Sure. So I think for med school in particular, there's a lot of challenges along the way. Obviously, you have to get the grades and you have to have the experiences that make you a well-rounded applicant. There are a lot of, and I'm happy to answer questions about this outside of this setting if people are specifically applying to med school, but there's a lot of things that I did wrong in my application process that I wasn't really aware of. I had graduated a couple years before and I kind of did it all on my own without the support of the of UMass directly, which I would not advise. I would advise you to go to the advising office and get all the help you can. But I made a couple mistakes, which fortunately didn't adversely affect me in the long run, but I could have just increased my odds of acceptance by doing a couple different things differently. Applying to more schools, for example, I limited myself, and so that could have been dangerous. But like I said, I ended up at UMass Med. It's really important to try to find a med school that is going to be a good fit for you. I loved it at UMass Med. It was a great fit. I felt happy there. The people were nice. We all kind of worked as a team. It wasn't competitive. So that was a great fit for me. That's what motivates me, and that worked for me. Some other people like external motivation in the form of competition, and maybe they need to go to a more competitive environment. And then ultimately, I think just marketing yourself is important. And by that, I don't mean make things up, but learn, like Joanna was saying, how to get the opportunities you need, make the most out of them, and then how to use those opportunities on your resume to make it seem like it's relevant and to highlight the points of growth that you've made. And I think learning all that is challenging and can be a hurdle, but if you work it out and ask for help and network, you'll get
Yeah, so Joanna and Katarina, they definitely hit most of what I was going to say, but I think it's so important to just get out there. I spent a lot of time my senior year being so nervous about, well, should I do this on my resume or should I do this or what should I use my cover letter? Of course, after going to, the resume center, career services, I still over obsessed. And I think that it's so important just to send your first one. And I know, at least for me, it was really nerve wracking. Like maybe it's not perfect yet, but I just sent it. And I think that, you have to put yourself out there and you're going to send a lot of resumes you should send a lot of resumes and you're not going to hear back from all of them. And you have to just realize that's okay. Because the ones you hear back from are the right fits. And I've applied to a lot of jobs, going so I went to graduate school, straight to graduate school. So out of graduate school, I applied to a lot of jobs, and you find the ones that are right for you.
Yeah. And more on that, and thinking of your first job and graduating and putting yourself out there. If you guys can just talk about what your first job after after your UMass career was, and what kind of opportunities were or are currently available for grads that are graduating this upcoming spring. Yeah, and I'll start that off with Katerina, if you have anything on that.
Sure. So I think there's a trend in medicine for less people to go directly to med school from college. And I think it's great. I took 4 years off, which is more than most people. But I think anytime you can take off, if you can do something constructive with that time, it's really, really valuable. So for example, and this is valuable for a couple different reasons. I worked in the food industry, and so I learned how to be good with service. And in medicine, you can't get away from, you are sort of a service personnel. Your job is to serve your patients. I work with nurses. I don't treat them like they're my teammate, but I also have to give them things. They need a result. I need to get it to them. So it is a service industry in a lot of different ways. I think being able to have that experience is really a good one, and it teaches you a lot about who you are and about how to be a good coworker. I also did a lot of what I call boots on the ground healthcare. So I was a PCA, a personal care assistant, for a young man who had hydrocephalus and was basically wheelchair bound, couldn't feed himself, couldn't do a lot of different things. And I would accompany him to his medical appointments. I would help feed him. I would help clean him up. Again, very humbling job. Not one I have to do anymore, but I have a heck of a lot of appreciation for all the support staff that helped me with those things. And I probably wouldn't have if I hadn't done that job myself. So those were some of the first jobs I had, and I did them at the same time. I did them in concert because I couldn't get a full-time job doing either one. So that's fine. Like, just maximize your time, do as much as you can. You have to survive, but if you can get some real tangible experience in healthcare before you head off to med school, it's great. It'll teach you a lot, you'll grow a lot, but also it'll help you identify if it's really what you want to do. And that's the most important thing. Medicine is a long road, and to get to where you're going, you're going to be slogging through it for a very long time, and you need to want it. And if you don't want it, that's great, but figure it out early because you don't want to trap yourself in a career that's not going to make you happy. You'll just burn out. That's about all I have to say.
Thank you. Joanna, anything on that?
Yeah, so actually mine tracks back to the end of my junior year. So for my first 2 years at UMass, I had worked at New Students Orientation, and I loved that job, spending the summer at UMass, welcoming students. But during my junior year, I had a conversation with one of my psychology professors about how I really wanted to do something in the mental health field. And they kind of recommended that I started looking at internships. And if I had, the financial capabilities of doing an unpaid internship, to do one. And I was fortunate in that sense that I could. So I always knew I wanted to work with patients with psychosis spectrum disorder, so schizophrenia, schizoaffective. So I started doing research on Google, and being from the Boston area, specifically in Boston Hospital. So I found a specialized clinic that's within Beth Israel Deaconess Medical Center. So I emailed the director of the clinic, which was probably the most nerve-wracking email I've ever sent in my entire life, as a junior in college, and asked her if they had any internship opportunities. And this is where, UMass connections. She emails me back, tells me that they do take students, but it's usually co-op students, but she was going to put me in contact with her CRA, clinical research assistant, who happened to be a UMass alum, to see if we could work something out for the summer. And we ended up working something out where I was going to be with them from May until August full time. So 40 hours a week of an unpaid internship. So I did that the summer after my junior year, went back for my senior year at UMass. And it ended up being that my supervisor from the summer, the UMass alum, she was going to go to graduate school to get her PhD in clinical psychology. So she was leaving the position, and they kind of wanted me to apply for the position. So from going back to my junior year of college, that's how I got my first job. It was a clinical research assistant in the psychiatry department at Beth Israel in Boston. and it was working with the psychosis population, and it was working on it was working at a clinic and at a research study that was NIMH funded, so funded by the federal government. Sorry, it's late. And so it was just a great experience, and I did that for 2 full years. It gave me the experience of working in the mental health field, directly with patients and their families, and really working in a multidisciplinary team. So we work with doctors, nurses, social workers, clinical psychologists. So I think just going back, I definitely think of like the chain of events, and I know that it doesn't happen quite like that for everyone, but I think from that moment when I kind of sent that first email as a junior in college to the director of a clinic, I don't think that's something that, sometimes you don't hear back from people, but you just never know until you try. So that was my experience.
Thank you. Yeah. And Michelle, anything to add on that point?
So I'll agree with, you never know until you try. I guess like I actually started UMass as a computer science engineer. And my path, I guess, to public health was a little bit different, but I figured out I wanted to do public health from being a patient. I tore my meniscus, and I ended up in like the University Health Services, like urgent care area, because I did it while on campus. And I became like really close with my doctor because it was several appointments. He ended up actually offering me an internship, and sort of like the same thing, you have to ask. And so I ended up working as an intern with one of the UHS doctors for 4 years, pretty much. And that was like my first real exposure to working in like the public health field. And that's, how I knew, I think it was like that day I went to my advisor. I was like, I can't do computer science. And so, it's, a little bit different for everyone, like what your moment is, but that was definitely a very like impactful moment. And then the doctor at UHS helped me get, I, much like Joanna, like I found an internship going into my senior year. I worked at the Holyoke Health Center. So I got to live out in Amherst for the summer, and I really loved it. And those experiences are invaluable because they will teach you things you didn't even know you didn't know, but more importantly, they'll help you make those connections. I still talk to all those coworkers I made there, and they're still in my network. So.
Thank you all for sharing those answers. I have a question from the chat, and this is open to anyone who feels compelled to answer it. Someone's wondering if I could ask what is a better advantage in getting into healthcare, GPA or experience? Like I said, open to anyone to answer.
I think it depends on what area of healthcare that person wants to get into, because definitely, as Katerina was talking about, if you want to go to medical school, you definitely have to have both, and your GPA and your MCAT scores are going to be really important. But if you want to go into an area like what I do, clinical social work, some schools do require the GRE and others don't. And then what they really look for is what experience you've had in the field, because a lot of people that would go to social work school for their master's have had worked before that. So not many people are going right into graduate school from undergrad, sort of the same trend as medical school. So it definitely depends on what area of healthcare that person wants to be in my opinion.
Yeah, I think that it's, I worked, when I graduated, I worked for UMass for a year. And during that year, I worked just like on like freshman experiences at the UMass Halal House. And when I applied to graduate school that year, so I took, about 9 months off. So when I applied, I remember so clearly getting a phone call from the admissions director, like telling me that they were looking for like more letters of recommendation and letters of and experiences. And so I actually like resubmitted my application because I had sort of done the opposite. Like had focused so much on like grades and academics because I didn't I didn't know like how to fit in. My year at UMass was not public health. And when I graduated, the admissions director told me that they loved that. They loved that I did something not public health and I had like a broader experience to bring. And I think that that's really important as well, to know that it doesn't necessarily mean you need to like go to work in the healthcare field, like food, kind of said, like food industry. It's just really important to have experience.
So for med school, I think both are important. For you as a student, I think the experiences are more important, just because, like I said before, being sure that this is what you want is going to do you a world of good. For the schools, I think they're both important. They obviously, there's grade cutoffs and there's MCAT cutoffs, etc. But they also do want to see that you're a well-rounded individual. They want to know that you can work well with others. And so it's really like a full package type of deal. There are other opportunities within medicine and patient care that don't require the same GPA. To be a physician's assistant, for example, a lot of people make that choice not because they don't have the grades, but because they don't want to go through the long haul of med school and residency and everything. And all they want to do is just take care of patients in a clinical setting. And they're very happy. They get paid pretty well. They don't have to be in school as long. And they don't, also those training programs are not, they don't have the same kind of ceiling or whatever in terms of a GPA to get into. So if you're not the strongest student, there's still a lot of opportunities out there for you.
All right, thank you guys for answering that question. We have a couple more coming in the chat. First, I'm gonna cue in Erica. She has a question and she's gonna unmute herself and ask you guys.
Hello. I'm asking as a sophomore at UMass, what is the best advice you can give an undergraduate like myself from all your guys' specific experiences when trying to enter the healthcare field?
Whoever wants to start on that one. Katerina, do you want to start?
Sure.
Okay.
So when I was a student, I think the things that I took advantage of, especially at UMass, and that actually helped me be very successful in getting into med school and figuring out that that's what I wanted, so being a university, and a rather large one at that, there's tons of research experience. And so I would highly recommend, if you're a scientific person and you're thinking about medicine, getting a little bit of bench research in before med school, primarily, or for a couple different reasons. One, they love research. If you can get on a publication, that's great. If you can't, but you still have done projects or whatnot, they're all valuable experiences in terms of applications. Two, those types of experiences can lead to other things. For example, there's the Howard Hughes Medical Institute Junior Fellowship Award that you can apply for or be nominated for if you do research on campus. I'm not sure it still exists, but I'm sure other things like that do. And so that was another thing I was able to take advantage of. And I kind of just fell into it because it was not a plan. It wasn't something I tried to do, but because I had some research experience and because I had a project I was working on, my PI was the one that said, well, you should do this, and nominated me. So you never know what each opportunity is going to lead to, and those can be very helpful experiences in the end. So I would say take advantage of as much of the opportunities that UMass offers as you can. Take advantage of the mentorship that you can, and also things like even studying abroad. I mean, now with COVID, I'm sure all that's kind of up in the air, but if you can at some point before you graduate, do some time abroad, that'll be good for your own growth. And it'll be one of those things that you're not going to feel like you didn't get to do. A lot of people find themselves years down in medicine being like, oh man, I haven't lived my life. But if you get to go do those things, then you don't feel that bad.
I think another important opportunity, if you can, definitely being a research assistant. And I know there's different ways of doing that. Also being a teaching assistant, especially if you're wanting to do an area of healthcare that it's more, psychology, social work, like things like that, for sure. If you have that teaching assistant experience, it looks well for applications for either job or graduate school. So if there's a class that you really like, you can, if you get a good enough grade, reaching out to that professor and seeing if you could be a teaching assistant for the next semester. I know if there's any psychology majors here, a lot of professors, and some of the classes are taught by different professors each semester, they kind of have a TA bank where they have like people's names that have done well in the class. So you could TA one semester for one professor and the next semester for another professor. And also utilizing career services. I don't think it's ever too early to start building on your resume and formatting it to a place where it's a one-page, really concise and direct resume. So if you, and there may be some experiences that you don't think, oh, I don't want to put that on my resume, but it could be applicable. So any type of like food industry or service industry, even if it was working as like the customer service rep at a store or something, if that's kind of what you have at that point, there's ways and different words, vocab words that you could use for your resume to highlight that. So
I think the only thing I would add is if you can find a mentor. I think that's like important. You're not alone. You have, the entire UMass network of people who want to help you. And so I think that, Connect UMass is a great way to do that. But also just, reaching out to your professors and, asking them to meet, not during class necessarily, but some, a different time or after class. Definitely finding a mentor is really important. And there are still mentors I had at UMass that I still communicate with and connect with.
Thank you all for answering Erica's question. I have another question from the chat directed directly at Katerina, and if anyone else wants to add in as well, please do so. But the question is kind of referencing what you said earlier about how you have to really want to go into medicine. And this person wants to know how you decided on medicine and how the long road that accompanied with how you decided to go into medicine.
Sure, it's a great question. I think it was kind of piecemeal. The first time I said I wanted to be a doctor, I think I was 16, and I had no idea what that meant. But that happened because my father had been in an accident and he had a brain injury. And so there was a lot of like personal reasons behind that. And so I was very self-motivated in that way. And then as I got older, I realized I'm really into science and I'm kind of a nerd. And the thing I liked the best was that the body, so I also liked engineering, which was kind of out there. I never had any experience with it really, but I like the way machines work. And when I figured out that the body was like just one really complex machine, that was really intriguing to me. So I was drawn to things like anatomy, I was drawn to things like biology, and I really enjoyed them as subject matters. I also really liked people, and I like working with people, and I like taking care of people. I feel very good about myself when I help people. So that's something that helps to motivate me. Not everyone does, I guess, but I get like a rush out of helping people. So those were all very good signs for me. In terms of being a doctor specifically, I think the reason I chose to go down that path was because I wanted to initially be a surgeon. I like to work with my hands, and I'm very hands-on type of person. And I like the idea of improving people's lives through surgery and fixing their problems. And I specifically want to do plastic surgery, like post-mastectomy, breast reconstructions, things like that. But then when I got into medical school, that kind of all changed. So you also have to keep an open mind about where you're going to go in life. But I think just knowing what I liked, why I liked it, and being insightful and thinking about, why do I like this? I don't want to be a doctor to make a lot of money. And the reason that's good is because it takes a long time to make any money, for one, but two, doctors don't get paid as much as a lot of people think. There's plenty of fields out there if you just want to make money that are better for you. It's not a good primary motivator. I don't know. It's a very good question, and it's pretty complicated, but for me, that's kind of how my path unfolded. I hope that answered the question. And then through the experiences I had, I was like, well, if I can do this, I can be a doctor.
I definitely think that answered that question. Joanna or Michelle, did you want to share a little bit about, I know that kind of question that's kind of already been touched upon, but if you had anything to add to your coming to realize that that was the career you wanted to go into?
I think I can talk about it a little bit. Like when I started at UMass, I was pre-med psychology major. I thought I wanted to be a neurologist, but which is interesting that I ended in social work because it's like still the brain, but a different aspect of it. Just because I always thought, I still think the brain is the most interesting organ. So that's where I was. But then through being a psychology major, I realized that I enjoy working with people and the side of like being a true advocate for mental health. So I kind of dropped the pre-med piece and stuck with and really focused on my psychology major. Thought I wanted to do a clinical PhD program, but found myself a little bit burned out with school once I graduated from UMass, and wanted to take time to work in the field and really know if this is what I wanted to do. And that's what a lot of people and some of my mentors had recommended me do anyway. And then through my job up at Israel, I worked with a lot of social workers and really found my passion for social work. And that's how I am where I am today as a clinical social worker. So it started off pre-med psychology major to now clinical social worker. So
I think
Awesome.
you guys hit everything.
Okay, great. McKenna, are there any more questions in the chat?
I don't have any coming through right now. So if anyone wants to send one over, please do. But I do have a question myself, if that's all right.
Awesome.
I think it sounds like a lot of you are in the same job that you sort of came into after college. But do you have any regrets about your undergraduate experience or anything that you might have gone back and maybe changed if you had the opportunity to? I know that's kind of a loaded one, but.
Oh, that's a great question. I 100%, I wish I studied abroad. I didn't because I was really like hyper focused on I need to get into a PhD program. So I need to take the classes. I need to get the GPA. I need to plan for my my GRE. So I was all set through the IPO office to go study abroad my spring semester junior year in London, England. And kind of like at the last minute, I like backed out from it. So that's probably my one regret for my undergrad career is not studying abroad and living in Europe for a semester.
I also wish I studied abroad. Do it, please, all of you. Well, maybe not during COVID, but
I was gonna say we've had a couple panelists suggest that, and we've kind of kidded back that if only that was an option right now. Hopefully.
Yeah, but I think it's really important, to have that experience and to see things. And like Katarina said, it's a long road for doctors, but it's a long road for anyone who is going for graduate degrees. So just, have fun in college too.
Yeah, I think it's important to still have fun. Don't get yourself in trouble, but have fun. Try to get any experience that you can. Of course, I went abroad and I loved it and I don't regret it. Some people may think taking time off, delaying things is going to be a negative, but I really don't think, you only get one life and you don't want to make it all about one thing. So try to live a fulfilling life while you're on this path, because that's going to be the way that you're happy and successful and also don't have regrets. So try to take advantages of those opportunities.
Thank you all for the answer on that one. I have another question from the chat, kind of relating more towards volunteer work. Did any of you volunteer in Amherst or in your college experience? And if so, do you feel like that experience helped you in any way? I know a couple of you talked about internships, but maybe adding on to that.
So I did lots of internships and volunteer work. I was like fortunate enough that I was in the position to be able to do that. My freshman and sophomore year, I like volunteered and interned at the American Cancer Society as the Relay for Life like intern volunteer. So that was really great. I volunteered there. I helped lead the 5 College Relay for Life. And I got to also have like the additional healthcare organization nonprofit experience. I think that's really something that also helped like my shape, my wanting to work for nonprofits. Because after that, I went and I worked on the Henry Gets Moving project at UMass, which was through that public health school. I don't know if it exists anymore. And then when I was in grad school, I actually got my graduate certificate in nonprofit management as well. So it really, those volunteer hours really helped me understand and direct me that I wanted to be involved in nonprofits and volunteer work. But I'm happy to talk to anybody who wants to know about volunteering, because I think I know about like all the volunteer organizations in Amherst.
I volunteered my freshman year and halfway through my sophomore year in the Amherst High School. I was a member of the Pre-Med Society, and part of preparing for medical school applications was having some volunteer work experience. So we used to volunteer at the high school after school as tutors. So I volunteered for 3 semesters, and we would help students after school, and we'll help them in any sort of subject, so English, math, science, and did that for about 3 semesters, which was really rewarding. And then I mentioned how I did a full-time internship between my junior and senior year for the full summer. And that was kind of like a volunteer in the sense that I was an unpaid intern, but it also gave me a real life example of what is it like to work 40 hours a week in the real world. So commuting, taking the train, having to ask for time off, sending emails to people that I would, a little bit think to myself like, oh my God, I can't believe I'm actually emailing the head of psychiatry at Beth Israel. So it was that kind of experience that I think if you're in a position where you're able to do that, which I understand not everyone is, because working unpaid 40 hours a week, it's a lot of time. But the investment for your professional growth, personal growth, I think if you're able to, it's worth it. And volunteering too.
I also wouldn't count out half internships. So my junior year, I volunteered at the Holyoke Health Center, but my job was only 25 hours, 30 hours a week. And so I was able to actually get experience working in the UMass corporate and foundation office for 15 hours a week. So I was able to build 2 things together to make a full-time summer experience. So I think that a lot of times people say oh, well, this is only 15 hours a week, or this is only 20. What am I going to do the rest of the summer? There's nothing saying you can't have more than one experience over the summer, or one experience at the same time.
I also did a lot of volunteering kind of throughout college, not so much locally, because I did that mostly in the summertime when I was home. For those of you who want to go into the healthcare profession in terms of direct patient care, I do think volunteering at a nursing home, again, these are things that probably can't be done right now because of COVID. But I volunteered in a nursing home. I worked on an Alzheimer's ward. I also worked in a day school for a pediatric day school for children who had suffered brain injuries and were no longer living with their parents, but were living at this home. And the Alzheimer's ward volunteering experience actually grew into a job. Even though I started it as a volunteer experience, by the end of the summer, I was getting paid to lead the life enrichment department, which is basically just play bingo with a bunch of forgetful older folks. It was more complicated than that, but basically volunteering can lead to bigger and better things for you, but it's also just a very interesting way to see the world and help out a little bit.
Thank you all for sharing that one. In addition, to kind of tack on to the end of that question, Faith, who is one of our pre-med advisors at UMass in the pre-health department, sent the link to a little document they've put together for different volunteer opportunities that are available during the pandemic. So I'm going to put this link in the chat. And if you guys want to pull that open, any attendees want to utilize that for reference. I know that Faith and the whole pre-med department have put some work into putting that together for us to use. So feel free to utilize that. We do have one other, I think we're going to have time for maybe just this one last question from the chat. Kara, if you want to unmute yourself and ask.
Hi. First of all, thank you so much for doing this. I feel like I learned a lot. So a little bit about me. I'm a junior public health major. I'm on the pre-med track, and I also really like working with people, but I've been pretty hesitant throughout the years, and I still kind of am, because I'm pretty uncomfortable with blood, and even though I like most sciences, bio is pretty difficult for me, especially molecular bio. So do you guys think that these could be possible red flags that might show that I'm not quite cut out for med school or the medical field?
It's an interesting question. There are definitely parts of medicine where you do not have to interact heavily with blood. There will be times where you're definitely going to see blood. So it depends, I guess, on the severity of your reaction to it, whether or not that would be something that should dissuade you. But I had friends in med school who, would get pretty queasy around it, and they still ended up in doing just fine. I'm happy to talk to you and explore this more through LinkedIn. If you want to reach out to me there, we can have a little bit more of a personal conversation about that. In terms of microbio or molecular bio, they're hard subjects. I think your book knowledge is important, but ultimately what makes you a good doctor is how you relate to people. And you have to have both pieces, but I wouldn't necessarily let one class or one grade keep you off of your track unless there's a larger problem. When you look at your GPA, it's, you're getting consistently lower grades in science courses that might be difficult for you to get into medical school specifically. But again, there are other areas of patient care that don't require quite as high of a GPA or quite as high a test score. And those people are very happy in their jobs, and they still get to work in multiple different areas. We have PAs, physician assistants, that work in radiology. We have physician assistants working in surgery. We have physician assistants working in the ED, and they're all providing care directly to patients. So there's a huge world of medicine. And if you have more questions, if that didn't answer sufficiently, then definitely look me up, and I'm happy to talk about it more.
Thank you.
I just want to say there's also a huge theme of healthcare too. So I never imagined when I was in your shoes that I could work in healthcare and never see a patient. I haven't the only time I see like, so before COVID, the only time I would see patients is when I would like go to the cafeteria to get lunch. I like work primarily like, you know, I was in a research building with labs, like there were no patients. So I think that that's also something just in general for everyone to like remember or to know, because I didn't know that that was, you know, really an option. Is I don't, yeah, I don't ever work with patients.
Thank you both for those answers. Kara, that answered your question. Did that answer your question?
Yep. I'm definitely gonna reach out to Katarina and possibly the other two speakers as well. Thank you.
Thank you. And just so everybody knows, all three panelists have very graciously allowed us to share their contact information with you as far as their LinkedIn links go. So I will be emailing all of you after this panel concludes so that you have that contact info for these three panelists. All right, so does anyone have any last minute? Oh, yeah.
Can I just say something? Just because I tend to be kind of busy, if I don't respond to you, that doesn't mean I don't want to talk to you. So I can sometimes need a reminder or two. So don't hesitate if I don't respond in a week to send me another message. Okay.
I think that was the biggest lesson I learned too, just for everyone. I used to think people didn't want to talk to me. They just didn't read my message. So feel free, you know, me too, but also just in general, when you're applying for jobs and internships and emailing people, follow up with them.
Yeah, I echo what Karina said. If you send me a message and I don't respond, it's not because I don't want to talk to you. Just feel free, and also echo what Michelle said. It's really, it goes back to what I was talking about with being proactive, and I think that's really important. And I don't know for other people, but you know, in healthcare right now, it's like changing times. So sometimes people are getting pulled in different directions in terms of meetings and planning and things like that. So that's why I have a set work schedule, but sometimes that changes where I'm still at work later or at work earlier. So it's just being flexible during these times too.
Yeah, I definitely agree with that. I think that's the biggest thing I've learned, especially being a student during this time, is giving everyone just a little bit of extra grace as far as responses and everything go. All right, so I think we just have our last kind of concluding question. Elia, I'll throw it back to you.
Thank you. I guess we can just all conclude with this final wrap-up question of what last advice would you give to a current UMass student looking for a job within healthcare? And I'll start off with Joanna.
I would say go into it with an open mind, because what you might think a career looks like it may be completely different. So I would say be proactive and keep an open mind.
So definitely keep an open mind. But I think the biggest thing is networking. You'll through networking, you'll learn what you want to do. You'll confirm that you want to do medicine or that you don't want to go into medicine. And, you know, I think both are equally important. So definitely meeting people, networking. And I know that that's hard during COVID, but we're here. We're happy to talk to you guys. So definitely friend us on connect with us on LinkedIn, and we'll definitely get back to you.
Yeah, I don't really have much to add to that. I think we've covered most of the things. I like the idea of being proactive, living your best life and trying to have as many experiences as you can, and just keep working hard and try to just focus on, you know, what are the things I want, and if it changes, that shouldn't make you feel bad. Some people feel like they've failed if for some reason they change paths. It's not a failure. You just got to keep going with it, rolling with life as it comes at you, and try to make the most of it.
All right, I'm just going to pull up. Thank you guys for that. I know that that's kind of a redundant question, but we appreciate the sentiment there. And here we just have a couple more closing thoughts.
Awesome. Thank you guys again. Thank you to our panelists and our attendees for joining us. We definitely hope that everybody kind of got something from this event, whether it's more information on where to look for some events or some experience, or just a new network, or just somebody to add in your network. So we hope that was all able to be accomplished today. We do want to mention something called Connect UMass, though. It's something that UMass is specifically using for our UMass alum and our current students. So the best way I can kind of describe Connect UMass is that it's a UMass specific LinkedIn-like profile, and it's a database of all UMass alumni, basically like the alumni that we have on this call today, that's pretty much just excited to talk to you about their career opportunities, how UMass kind of set them up for their career opportunities, and just help you kind of get your foot in the door. Because like we always love to say, when it comes to alumni relations, that it's not about what you know, it's who you know. And I think with this event in particular, the best way you can do that, especially within healthcare, is just building your network with more and more people. And with that being said, I'm actually going to just drop the link to Connect UMass. So please utilize that link, click it. It takes literally probably 5 minutes to just set yourself up, make a profile, and honestly, the database just connects you with alumni in itself. It does that already for you, which is really awesome too. And then of course, we're going to mention Handshake, as it is another UMass resource to use for internship co-ops and research and things of that sort. And to conclude, this is actually our last SAA Wednesday. So thank you all for joining us during this entire semester. We really hope these sessions kind of helped you out, again, build your network, give you more insight on what you want to do with your career once you leave UMass, or if your major is the one that you want to use for. Again, you are UMass. And if you have any questions related to alumni relations, or just want to stay, I guess, keep the conversation going and stay intact with the Student Alumni Association and just alumni relations all together, feel free to follow our social media. We do use it very heavily and pretty consistently, updating with events like this, student spotlights of just students that's here on campus, and just more events from the Student Alumni Association. So thank you all.
Before you conclude, I might add that we also now have a YouTube page with all of our SAA Wednesday recordings on it. So if you are looking to look at any of our other ones, or if you found this interesting or know friends that couldn't make it tonight, please let them know to check out our YouTube page as well.
Awesome. Yes. So thank you again. Thank you guys all for joining us, and we hope you have a safe and healthy week.